Hi, Jamie Davis here from the ANIA Conference 2016 in San Francisco for the Nursing Show, and I want to thank everybody for checking out this segment. We're going to be talking to Leslie here about one of her poster presentation, one of the many poster presentations that have been here at the conference. But Leslie, before we get into that, I always try to ask our nurses on the show why they wanted to become a nurse.
You know, I had a lot of family members that were nurses, so when I was just a youngster, toddler, I loved sitting around Christmas, holidays, talking about nursing stories, and it's just always intrigued me. So I knew from a long time ago that I wanted to be a nurse.
So you take that and you go to the next step. What drew you to the specialty of nursing informatics?
Well, you know, it's interesting. The company that I work for, we deal a lot in informatics, collecting data, looking at analytics, but probably in a more non-traditional way than a lot of the other poster presenters here this week. But we're really looking at data on the pre-employment and post-hire side to help hospitals really determine who the best candidates are for their open positions, as well as helping to drive individualized education on the back end. So it's really just a unique specialty, and it's a unique environment which I currently, operate and work for my employer. So it's just a fascinating industry to be in.
Excellent. So you're presenting here. You have something to talk about with regards to that. What is the question that you were trying to answer with your presentation? What kind of research were you doing?
Well, in 2008, our company did a research study with over 900 nurses. And really what we were looking for were not only job knowledge traits, but also interpersonal skills and personality traits. So we were really trying to determine what is it that really makes up successful job performance for a nurse. And what we found was that we were able to predict how well someone can perform on the job based upon their test scores of this holistic approach. So we really were just really excited about using a new traditional, non-traditional way of assessing candidates. So it really helps hospitals on the front end to help determine who the best candidates are instead of just using an interview alone.
That's an interesting application of having that kind of data to really help find the best nurse for the best fit for that position. And it doesn't mean you're excluding people necessarily. It just means you're helping each nurse find the best position for them.
That's right. And it's really been impactful for hospitals when they're hiring new graduates, because a lot of times new graduates don't necessarily know what specialty that they want to work. They might have an idea, but whenever they take these assessments, they can really determine, based upon my personality skills, am I a better fit for the emergency department, or would I be better suited for med-surg or possibly ICU and so on. So it's a great predictor on how well someone's going to perform based upon their own inherent traits.
Excellent. Well, that's really fascinating. What kind of takeaway would you give to that person that hasn't been to a conference like the ANIA conference, if they're an informatics specialist in nursing? What would you tell them about coming back and coming to next year's conference?
Okay. This is my first time attending this conference, so I certainly want to thank ANIA for allowing us the opportunity to present a poster this year, but technology is just really ingrained into everything that we're doing these days in healthcare, and there's more opportunities, I think, for nurses than ever before. Excuse me. And I just think that with technology driving so much of what we're doing, and technology involved in what we do every day with smartphones and Fitbits and different things, I think that the wave of the future for nurses is really going to be around technology and how do we use data to improve patient outcomes.
Excellent. Well, Leslie, thank you so much for coming on and joining me for a few minutes.
Okay, thank you.
And I want to thank all of you for checking out this segment here from ANIA 2016 in San Francisco. I'm Jamie Davis for the Nursing Show. Remember, all the segments that I've recorded here, about 20 or more, are going to be available for you over at ania.org. So check out all those segments over there, and also available for you over as well at nursingshow.com.